Root canal treatment, also known as endodontic therapy, is a dental procedure that is often necessary when the soft tissue inside the tooth, known as the pulp, becomes infected or inflamed. This can happen due to a variety of reasons, such as deep decay, a cracked tooth, or repeated dental procedures on the same tooth. If left untreated, an infected pulp can lead to severe pain, swelling, and even tooth loss. So, what is the procedure for getting a root canal? Let's break it down step by step. 1. Diagnosis. The first step in the root canal procedure is to diagnose the need for treatment. Your dentist will examine the tooth and may take x-rays to determine the extent of the infection or damage to the pulp. Based on these findings, they will recommend a root canal if necessary. 2. Anesthesia. Before starting the procedure, the dentist will numb the area around the affected tooth with a local anesthetic. This ensures that you will not feel any pain during the treatment. 3. Access to the pulp. Once the area is numb, the dentist will create a small opening in the tooth to access the infected or inflamed pulp. This allows them to remove the damaged tissue and clean out the inside of the tooth. 4. Cleaning and shaping. Using small instruments called files, the dentist will carefully clean and reshape the inside of the tooth to remove any bacteria and debris. This also allows them to create space for the filling material that will be placed later. 5. Filling the root canal. After the tooth has been thoroughly cleaned, it is time to fill the root canal. The dentist will use a rubber-like material called gutta percha to fill the empty space inside the tooth and seal it off to prevent reinfection. 6. Temporary filling. In some cases, a temporary filling may be placed to cover the opening in the tooth until a permanent restoration, such as a crown, can be placed. This temporary filling protects the tooth and prevents bacteria from entering. 7. Crown placement. In most cases, a tooth that has undergone a root canal will need a crown to protect it from further damage. A crown is a custom-made cap that is placed over the tooth to restore its shape, size, and function. 8. Follow-up appointments. After the root canal procedure is complete, you may need to schedule follow-up appointments with your dentist to ensure that the tooth is healing properly. These appointments may involve x-rays to check the status of the tooth and ensure that there are no signs of infection. It is important to note that a root canal is a relatively common and safe procedure that can save a tooth from extraction. While the idea of getting a root canal may sound intimidating, advances in dental technology have made the process much more comfortable and efficient than in the past. If you are experiencing severe tooth pain, swelling, or sensitivity to hot and cold, it is important to see your dentist as soon as possible. They will be able to evaluate your symptoms and recommend the appropriate treatment, which may include a root canal. A root canal is a necessary procedure to save a tooth that has a damaged or infected pulp. By understanding the steps involved in the process, you can approach the treatment with confidence and know what to expect. Remember, the goal of a root canal is not only to relieve pain and discomfort, but also to preserve your natural tooth for years to come.